We'd like to welcome Megan Weigel here on December 15, 2015, and we're so proud to have her here today because she's like just so spectacular of a speaker and a clinician here in the Jacksonville area. And we just wanted to ask her some questions regarding the oral MS medications. So, firstly, why don't I just ask you the names of the oral MS medications? Tell us the name by generic and by brand, if you can.
Am I being graded on this?
Yes.
So I'll go even in order of how they were approved.
Great.
How about that? So the first was fingolimod, which the brand name is Gilenya. The second was teriflunomide, the brand name of which is Weigel. And the third is dimethyl fumarate, the brand name of which is Tecfidera.
Fantastic. So can you tell us about how, I mean, obviously they're orals, but when are they used? How are they used? How many times a day or how many times per week?
Fingolimod or Gilenya is used once a day, as is Weigel or teriflunomide. Tecfidera, I'll say DMF, dimethyl fumarate for short, DMF is a twice-a-day medication. Gilenya and Weigel can be taken with or without regard to food. Tecfidera is advised to be taken with food, specifically something that's higher in like fat or protein, just to minimize the risk of GI symptoms that sometimes happen with the medication.
What is like a food item that they could take? I've heard some people eat cheese.
Cheese, peanut butter, not just like what we call tea and toast,
Right.
Something with some substance to it.
Right, okay, great. So what are the known efficacies of these medications?
Well, the oral medications were studied in a different population than our traditional platform injectable therapies. So people who were diagnosed earlier, perhaps by different criteria. And so we think maybe the efficacy numbers may be a little bit higher because the populations are a little bit different. So if you look at numbers across the board, just numbers, the efficacy for annualized relapse rate reduction with Gilenya and Tecfidera looks higher than with the injectable therapies. And then with Weigel, the annualized relapse rate reduction looks to be about similar with some of the injectable therapies. But there's never been a trial with the oral therapies comparing one another head to head.
Let's hear about the benefits of each of these oral medications.
Okay, well, they were all studied with looking at primary endpoints of relapse rate reduction, MRI endpoints, different MRI endpoints based on what drug, the way they're calling their MRI endpoint, and then sustained disability progression. And so, and I just do want to go back. So Gilenya is the only oral that did do a head-to-head study versus an injectable therapy. And that injectable therapy was Avonex. And so they did prove in their clinical trials that they had a better relapse rate reduction and better MRI outcome. But the sustained disability progression delay was not statistically significant versus Avonex. And to me that makes sense because Avonex is a known, effective therapy. The other thing that I think is important to mention is that Tecfidera in their second clinical trial, I believe it was their second, they did a Copaxone arm, and they have to do that for the FDA to show that there's a similarity. But the study wasn't powered to be a superiority trial. So when you look at their data, they did what's called a post hoc analysis. So they look at the data after the fact and they see, well, is Tecfidera doing better, the same, or worse than Copaxone? And their post hoc analysis suggested that Tecfidera performed better than Copaxone on their primary endpoints. However, there's some statistical magic involved in that. And since the study wasn't powered to detect whether or not Tecfidera was superior, you really have to be careful when someone's saying to you, well, look at these numbers, Tecfidera is better than this medication. So I think it's important to just say that stuff too.
Sounds great. Thank
I
you.
forgot the question you asked me.
I asked what the benefits were.
So the benefits of oral medications are, well, they're oral, right? And so they're a lot easier to take than an injectable medication as far as, doing harm to oneself. It's hard for a lot of people to say, I'm going to give myself an injection every day or 3 times a week or every other day or even once a week. Benefits of the medication, so then are ease of use. For people who have failed injectable therapies, either because they've had relapses or their MRIs are changing or they're continuing to progress in disability but still in a relapsing phase, now we have 3 other choices to offer them as a next step in treating their multiple sclerosis. Since each of the oral therapies work differently than one another, and the interferons and Copaxone work differently, we have essentially 5 mechanisms of action of which to choose from if you're just talking about those 2 delivery mechanisms of drugs for people with MS who aren't doing well in their current disease-modifying therapy.
Okay, great. Thank you for that.
Uh-huh.
So what are the disadvantages, though, of an oral medication, like with regards to maybe adherence or compliance to the use of taking these oral meds?
So in my opinion, the disadvantages of the oral medications are that they do require more frequent laboratory monitoring, and even by their label, but then also by what as an MS specialist or neurologist and PPA, what we're all doing in our practice with our patients. So for example, Weigel requires monthly liver enzyme monitoring for 6 months. Gilenya requires regular blood count and liver enzyme monitoring, and I think that many of us are doing that more frequently than we used to because of cases of PML, of the 3 cases of PML with Gilenya, and same with Tecfidera. So Tecfidera's label suggests that we just need to check a blood count once a year when a person is on the medicine, and now that there have been 4 cases of PML with Tecfidera, and I know that I was doing this before, I'm monitoring blood counts much more frequently, and then determining how I monitor them based on what their absolute lymphocyte count and white blood cell count are doing. And I also monitor liver enzymes regularly with Tecfidera and Gilenya, more regularly than the label suggests that we should. So we're asking patients to go to the lab more frequently, which is inconvenient and sometimes expensive. And then there are other specialists that might be involved. So for example, with Gilenya, prior to starting the medication, one needs to have an EKG and see an eye doctor. And in my practice, I ask that they see a dermatologist as well, and then have regular ophthalmology follow-up, regular dermatology follow-up. And so there's a little bit more involved than, say, I'm taking Copaxone, I'm injecting myself daily or 3 times a week, I don't need any labs, I just need to make sure my injection sites look okay.
Great, fabulous. Are there any new orals in the pipeline to come out like in the next 10 years?
Oh my gosh, yeah, in the next 10 years, I can't even count nor can I pronounce how many orals there are.
Try it. Just want to hear it right here at the end.
Gosh, you caught me at the end of the day. They are looking, researchers are looking at several S1P inhibitors, so molecules that are similar to Gilenya. There's also a molecule that is like very high dose biotin that may be effective in progressive forms of MS. And then, there are all sorts of other injectable and IV therapies that are on their way out.
Great.
Yeah.
So Megan, thank you for being here with us today. It was great. I do appreciate your time and for everything that you've done and what you do for the MS community.
Thanks, Stu. It's my pleasure.
We'd love having you.
Thanks
Thank
very
you.
much.